Hello, everybody. Can everybody hear me okay? Yeah? Okay. So my name is Matt, and I am the coordinator and social worker for an organization called the Alan Malka Green Artist Health Center. So we're located at Toronto Western Hospital, and we are a healthcare clinic that's designed for the health and wellness of professional artists, students of the arts, and teachers of the arts. We are an interdisciplinary clinic, so we're a mix of different mental health and physical health care providers. And I was asked to come and talk here today about the concept of intimacy in healthcare settings. I'll probably use the terms intimacy and vulnerability interchangeably, I think, during this talk. And I just wanted to name right from the beginning that I'm feeling very vulnerable here today because this is the concept that I've never spoken about before in a group setting. So I'm really happy to be here because as I did some research on this talk, I really noticed some relationships between theater and healthcare within this concept. And it's really nice to see the direction that theater is going in terms of helping to protect theater professionals when it comes to intimate environments and intimate scenes. So when it comes to intimacy from a healthcare perspective, intimacy really is about closeness. So when it comes to healthcare providers, we get very close to our patients. So I myself am a social worker and a psychotherapist, and in terms of the work that I do, I encourage people to tell me very deep personal stories 5 minutes into meeting them, really. So I really encourage people, and it is encouraged, to be very vulnerable right from the get-go. And I interviewed some of our practitioners before coming here today, and our massage therapist reminded me that what she does is she meets people for 5 minutes, and then people take their clothes off in front of her. So people are extremely vulnerable right from the beginning in healthcare settings. So it is a very unique setting when it comes to the concepts of intimacy and vulnerability. And it was really interesting chatting with the different providers because really when I talked about the concept of intimacy, where everyone's mind went right away were professional boundaries. So we do encourage people to be very vulnerable. It is a very intimate setting, and it's really important for us to make sure that we maintain appropriate boundaries with the people that we're working with, which I think is really important in theater also. That you are really encouraged to be intimate, you're encouraged to be very vulnerable, and it's important to make sure that there are appropriate boundaries and that there's safeguards that are in place to make sure that it's done effectively. And so where the crossover really comes into play for me is the concept of safety. So when it comes to healthcare, it is really important for us to encourage people to be very vulnerable and to be open, but to make sure that it's done in a very safe and effective way. And so it was really nice for me to do a little bit of research on this concept of the intimacy director because I think that that's an amazing and important resource that in terms of being vulnerable, it's really important for us to make sure that we've done this in a safe way, and sometimes we need an advocate. Sometimes we need another person who's slightly outside of the mix to make sure that actors and in our context, our patients are safe. So a couple of concepts come to mind for me. The first is the concept of trauma-informed practices. So in the context of mental health, the rule, as opposed to the exception, is that the people that we work with have experienced some sort of trauma. And so the concept of trauma-informed practice essentially means that going into any kind of client interaction, I go in with the assumption that they've probably experienced some really significant situations. They potentially have been traumatized in some sort of way, and it's really important for me to be mindful of that. And so when I'm talking to clients, I have to make sure that I'm talking in a way that creates a safe boundary, that knowing that potentially anything that I say to them could potentially be triggering. And I want to do my best to mitigate anything that could be triggering for any of the clients that I'm working with. Because for somebody who hasn't experienced a trauma, a conversation about relationships, for example, could be completely innocuous. But in the context of the work that I do, even just speaking about relationships can be very triggering for somebody. And so every time that I talk to someone, I have to make sure that I've laid the groundwork, that I give them the sense of control also. So when I'm talking to the clients that I work with, I really make sure that they have the right to openly share what they want to share with me, that they have the right to stop, that they have the right to say, no, you know what, I've just met you. I don't feel comfortable talking about this right now. Maybe we'll save that for another day. And so when it comes to this concept of trauma-informed practices, really what I'm doing is making sure that people know that they have the right to share as much or as little as they want to, and that in turn can help to create a sense of safety. The second important concept, which I think crosses over into the theater world also, is this concept of anti-oppressive practices. So essentially, when it comes to anti-oppressive practices, what that means is that there are inherent power imbalances between healthcare provider and patient, and we need to do our best to try to mitigate those power imbalances, which can be very difficult to do. So, like, to bring this back to the theater world, it's really nice to see that there's an intimacy coach who could be that person who could try to mitigate the power imbalances between actors and directors. Sometimes in healthcare, we have to be our own advocates for our own healthcare. So there are these power imbalances, and sometimes the healthcare providers that we're working with maybe don't get it right, or maybe haven't listened effectively. And because of that power imbalance, it could be difficult to speak up, and oftentimes we are in a position to have to be our own advocate for our own healthcare. So how does that look? So right now, my dad is going through cancer treatment, and his cancer is in his tongue. So because of the cancer and because of the treatment, he can't talk. And we were at the hospital the other day, and a nurse came up to give him a blood thinner. He does not need a blood thinner. So it ended up potentially being a dangerous situation where he was potentially given an injection that he didn't actually need. And so thankfully, my family was around to be able to advocate for him. But that's a really serious example of how power imbalances can actually harm people in healthcare, and how important it is to make sure that we have systems in place so that patients can advocate for themselves, or there's others that are around so that others can be the advocate for the patients. Another example that comes to mind is I was working with a man several years ago who couldn't urinate, and the doctors were telling him that it was a mental health issue, that he had anxiety, and he was dead set that there was something physically wrong with him. And so he was sent to me, the social worker, to help with treating his anxiety when in fact, actually, there was something physically wrong with him. And so as a social worker, it is a part of my job to advocate for my clients. And so in different healthcare settings, there are social workers that are available. And so I guess just a shout out to social work. If you are the patient in any sense and you don't feel like you are being treated effectively, go and seek out a social worker, because a part of the social worker's job is to advocate for you. And so what I did was go back to the physician and ask for another consultation, because the original consultation actually wasn't accurate. And then in the end, they did end up finding something physically wrong with him. And so thankfully, we didn't spend a ton of time treating his anxiety, which actually didn't exist in this context. And so what can we do about this? Well, there are patient advocates that exist. So that typically is seen more so in the mental health realm, where there are people who, because of the nature of their mental illness, don't understand the nature of the consequences of the treatment that they're getting. And so there are patient advocates where a patient can go to who can help to support and who can help to talk on behalf of the patient. In contexts where a patient literally cannot consent to treatment because they're so unwell that they don't understand the nature and consequences of their treatment, substitute decision makers can be assigned. And so that substitute decision maker, their job is actually to make decisions for their healthcare that are in line with what the patient would originally want. So their job is not to just decide what the most effective course of action is. The substitute decision maker, their role is to make sure that the treatment options that are available and that are being taken are actually in line with what the patient actually wants. So I'm also supposed to be talking about touch here. And so as a psychotherapist, I don't touch clients typically, as a rule. It does come up sometimes in the work that I do at the center, because I do single session psychotherapy, and so I don't see clients as often as others would in longer term psychotherapy sessions. And so sometimes clients hug me at the end, and if they go for it, then I'll hug back, I guess. But typically I don't, and most psychotherapists don't. But when it comes to touch-based therapies, like massage therapy, of course, touch is a part of the therapy. And so touch, as long as it's being done appropriately, can be very therapeutic, can be very effective. It's important. I was talking to a massage therapist, and she talked about how starved people are for touch. And typically, we think about touch and massage in the context of physical health, back pain, muscle tension, but it's really important when it comes to mental health also. In the work that I do, I often encourage people to have body-based therapies done because so much of our mental health is also living in our bodies as well. I've got 3 more minutes. All right. So we want to make sure that if we're getting any kind of treatment, of course, I've said this word many times, that it's done safely, that it's done effectively. And just, I guess, to wrap up, in the end, if I'm to talk about intimacy and touch in healthcare, it's important to be safe, accepting, validating. It's important to have professional boundaries, and it has to be treatment focused. And if all of that is there, it can be incredibly powerful, and it could be incredibly healing. Thank you.